Hello, my name is Bob Kerner. I'm one of the faculty members here at the Patient Safety Institute. In the next few minutes, I want to introduce you to SimMan, one of our high-fidelity patient simulators. The purpose of this introduction is to familiarize you with the technology in use so that you can get the most out of your visit here. Let's start at the head. All of our simulators are capable of speaking. Hi, my name is Bob. I'll be your nurse today. What is your name?
My name is Thomas Moore.
And your date of birth, Mr. Moore?
May 5th, 1952.
That's fantastic. I think you'll find that many people will ask you your name and date of birth so that they are certain they are taking care of the correct patient. In addition to speech, all of our simulators can make pre-recorded vocal sounds such as coughing and sneezing. Could you cough for me, Mr. Moore? Thanks, that was wonderful. Although our simulators cannot open their eyes, each simulator does have a set of eyeballs and pupils, so it is important to assess them and tell us what you find while you do your assessment. There are several locations where you can assess SimMan's pulses. Central pulses may be assessed at the carotid, and the carotid pulses are relatively medial. They're right next to the larynx, and it requires a little bit of pressure on the skin to make the pulse activate and become palpable. You need to know that the carotid pulses, after they are activated, they'll only run for about 5 to 10 seconds. After that, they will shut off, and you'll need to repalpate to re-engage the pulses. You may also assess the pulses on the left arm. The left arm contains a radial pulse, where you would normally expect to find it, and a brachial pulse, which is ordinarily concealed underneath the blood pressure cuff. Both of them are touch activated, which means once you press the soft pad on the arm, it may take a moment or two for the pulse to actually start pulsating so that you can feel it. On any of the peripheral pulses, if you press more than one at the same time, it will shut off the pulses altogether. Each SimMan has bilateral femoral pulses. Again, you want to locate the softer pad on the mannequin and press firmly down until you feel the pulse pulsate back at you. Some of our simulators have dorsalis pedal pulses, which when you press on the appropriate location on the top of the foot, you'll feel a pulse. However, not all of the simulators have this pulse. If you palpate the foot and do not feel a pulse, you should still tell us that you're assessing the distal pulses. Let's turn our attention now to SimMan's chest and abdomen to auscultate his heart, lung, and bowel sounds. The sounds that SimMan can produce are realistic. However, they are transmitted through tiny transistor radio speakers. What that means for us is that unless we have the diaphragm of the stethoscope located precisely over the speaker, we might not be able to hear the sounds very well. So it's very important that you pay attention during this section to see where to put your stethoscope for optimum listening pleasure. Let's begin by exposing the chest. To listen to the apical heart rate, we need to put the diaphragm of our stethoscope right in the center of SimMan's chest. Now, this is not where you would expect to find an apical heart rate on a living human being, but this is where you need to put the diaphragm on the simulator. If you put it in the center of the chest and listen for a moment or two, you should be able to hear the patient's apical heart rate. Note that if you move your stethoscope, even a quarter of an inch either way, you'll not hear a very clear sound of the heart rate. You'll hear a washout from other speakers in the chest. So if you're not hearing what sounds like a heart rate, you may want to reposition your stethoscope by a quarter of an inch either way until you hear it crystal clear. The patient's breath sounds are heard best by listening to the breath sound speakers. And those speakers are just above and medial to this big nub here that we use for our hands-free defib paddles. So we want to put our stethoscope there and at about the same location on the left side of the chest. And once again, if you move your stethoscope an eighth or a quarter of an inch in either direction, that may improve what you hear. To listen to the bases of the lungs, we want to have our stethoscope about an inch below the nipple line and more or less in line with the nipple on each side of the chest. Now, it's important to note that you have to put your stethoscope in your ears properly. Make sure that the earpieces are angled into your ear canal and not out toward the fleshy part of your ear. To listen to bowel sounds, we want to pull down the gown, identify the belly button, and the speakers are on either side of the belly button. There are no breath sounds in SimMan's back. Therefore, it is not necessary to sit the patient forward or roll him over to listen to the posterior thorax. However, that would be part of a routine physical examination, so when you come to the part of your assessment where you would perform that, please tell us that that is what you want to do. As you auscultate and examine the chest, you'll no doubt notice and hear that the chest makes noise as the patient breathes. If we watch carefully and listen, we'll notice that there's a squeaking or rubbing noise each time the chest rises and falls. So that's the sound of the mechanical parts moving and rubbing together inside SimMan's chest. We do our very best to try to alleviate those sounds prior to you interacting with the mannequin, but there are sounds that are unavoidable. Therefore, it's very important that as you auscultate the chest, you make sure you're over the speaker and you distinguish the sounds coming from the speaker from the sounds created by the chest moving. If you're troubled by this and can't auscultate the breath sounds clearly, please say so out loud so that the people in the control room will know you're having difficulty. Blood pressure can be assessed using the attached sphygmomanometer and your stethoscope. Place the diaphragm of your stethoscope in the center of the circular soft patch in SimMan's antecubital fossa. Inflate the cuff as you normally would, watching the gauge as you inflate. When you've reached the level that you want, slowly and gently release the air while watching the gauge. Please note that the sounds made by SimMan are not consistent with the cough sounds made by a real patient. A real patient sounds would be pulsatile or almost like a whoosh. SimMan sounds are more like a click or tapping noise. You may have to listen very carefully to hear SimMan's cough sounds. If you are having any difficulty measuring the blood pressure, please say so out loud so that the people in the control room will know that you're having difficulty. Each room has a pulse oximeter. It is hanging on the wall behind the head of the bed and looks just like the pulse oximeter you would expect to find at your hospital. It's a finger clip, so you take it and apply it to one of SimMan's fingers. You can apply the pulse oximeter to the fingers of either hand. Once you apply it, a pulse ox tracing will come up on the monitor screen hanging at the head wall. If the clip falls off the patient's finger, the monitor tracing will go away until you put it back on the finger. The pulse oximeter, just like the vital signs, is physiologically correct. So if your patient is having respiratory difficulty, you might expect that the pulse oximetry reading will be affected by that difficulty. Similarly, if you give your patient oxygen, you might expect that the pulse oximeter would reflect that and show improvement. You will see some other technology hanging off the head wall close to where the pulse oximeter cable hangs. These boxes here hanging on the wall control the mannequin. We'd ask you please not to touch the box, and please don't be tempted to pull the cable here off the top of the box. This is not the pulse oximeter cable. The oximeter cable is hanging to the left side of that on the little clip. If your patient's condition warrants the administration of oxygen, you may select an appropriate oxygen administration device from one of our bedside tables, hook it up to the oxygen regulator hanging on the wall here, turn on the oxygen, and apply it to the patient. Oxygen masks can be applied to SimMan without any difficulty whatsoever. You'd apply them in the normal fashion. The nasal cannula goes in the nose, and very often you have to finesse it a little bit to get it to stay on his ears. His ears do not hang out from the side of his skull very prominently, so you kind of have to coax it into the little cracks there. Please make sure that your oxygen is turned on and set to an appropriate liter flow, and of course reassess your patient using the pulse oximeter. You may notice various tubes or wires hanging from the underside of the bed. In this case, down by the foot of the bed, you see what looks like some drainage tubing running to the undercarriage of the bed. These tubes and wires are necessary to make the mannequin run. In this case, this is a drainage system for the IV system. This is not a Foley catheter. So if it looks like we're trying to hide it from you, we are, because it's not integral to your simulation. Each mannequin has lifelike genitalia and a urinary bladder that can be catheterized. So if you are concerned that your patient has a Foley catheter, the best place to look for that is at the genitals and not at the undercarriage of the bed.